In our last section today, we're going to talk about the credentialing of supervisors. So I want to talk a little bit about the state of Florida and its requirements for becoming what's called a qualified supervisor. For Florida Board 491, this board, of course, covers the professions of mental health counseling, clinical social work, and marriage and family therapy. And there are different requirements in order to be a qualified supervisor of these different professions. And remembering that with Florida Board 491, there's typically 2 years of postmaster's requirements of clinical work. And this is where the 2 years that is the supervisee or the registered intern is working has to be done under the supervision of a Florida qualified supervisor. In general, for all three of the professions here, a qualified supervisor must hold an active Florida license and typically has to have a 16-hour supervision class or a 3-hour graduate level supervision course. There may be profession-specific coursework required and also clinical experience of your own as a clinical supervisor. So I'm going to talk a little bit about these three professions, and this Board 491 requirement went into effect in February of 2000. So the link here is on the slide for you if you would like to read these specifically. However, the requirement for a qualified supervisor is that effective in 2000, any individual serving in the capacity of a qualified supervisor for registered interns in Florida must have completed training and supervision defined by the rule and chapter of the Florida Administrative Code. Determine if you qualify to provide supervision. And what's important is that the training that you get, it has to be subsequent to licensure. So, for example, if you took a graduate level supervision class, but you weren't yet licensed, then that would not count. You would, after licensure, have to take either the 16-hour, the 2-day workshop on supervision, or take a regular 3-hour graduate level class. For the Board 491, for supervision of clinical social work and marriage and family therapy or mental health counseling, the following two of the following 3 steps have to be completed. Again, completing a supervisor affirmation statement, which is part of the application, and complete the education verification. And this is where it can get somewhat complicated, because if you are wanting to supervise across professions. For example, if I as a mental health counselor want to supervise clinical social work registered interns, or if I want to supervise marriage and family therapy registered interns, I have to provide certain documentation that I have had coursework in those programs. So again, you send your application and the supporting transcripts and documents to the board, and once you are approved, it will be basically an addition to your license. You'll get that qualified supervisor designation, in which anyone can look you up to see if you would be able to supervise for that postgraduate pre-licensed hours. So just briefly, if you are interested in supervising clinical social work interns, again, the same educational requirements that you have to have had training and supervision. You can be what's called an AAMFT approved supervisor, this is the Association of Marriage and Family Therapy, or you can have a postgraduate training course for field instructors specific to clinical social work. In here, with the social work, you have to have had 4 years of clinical social work experience, 2 of which could be earned during your postmaster's clinical internship or your registered internship. So if you are not an LCSW, if you're not the licensed clinical social worker, in order to supervise registered clinical social work interns, you will also need to provide documentation that you've had a minimum of 9 semester hours, so 3 classes in a graduate program of social work. And then it lists the possible classes that would count towards that. So many of us, for example, my degrees are in counseling. They weren't within the School of Social Work. I would have to go and take 3 additional graduate level classes in the field of social work in order to be a qualified supervisor for clinical social workers. And these are the requirements for supervising marriage and family interns. Again, similar with the educational requirements of having a graduate level course or training. You can be an AAMFT approved supervisor. For marriage and family, you need 5 years of clinical experience in marriage and family therapy. Again, 2 of which can be during your registered internship. So this would mean 3 years post-licensed with the experience requirement. But if you're not an LMFT and would like to supervise LMFT registered interns, you would have to document that you've had a minimum of 6 semester hours of graduate coursework in marriage and family therapy. And of course, you'd have to provide transcripts to support that you've had those courses. So the next slide here talks about the Board 491 requirements for mental health counseling supervision. And I realize the writing on this slide is kind of small, but you can actually go to the website a couple of slides back and it will give you all this information. But in order to supervise a registered mental health counseling intern, again, you can have the educational requirements of coursework or workshop, or you can be what's called an ACS, or an approved clinical supervisor, which is designated by the Center for Credentialing Education. It's a part of NBCC, or the National Board for Certified Counselors. You can also be an AAMFT approved supervisor, or a postgraduate training course for field instructors in clinical social work would also satisfy that supervision requirement. For mental health counseling, you must have 5 years of clinical experience in mental health counseling, 2 of which could be earned during your postmaster's registered internship. So again, the same with marriage and family therapy supervision, 3 years post-licensure work. If you're not an LMHC, in order to supervise the registered mental health counseling interns, you would also need to provide documentation that you've had a 3 semester graduate level coursework in some of the following areas that are specific to counseling. Also note that if you are licensed as a psychologist in Florida, you can complete a minimum of 3 years of experience providing psychotherapy, consisting of a minimum of 750 hours of direct client contact per year to qualify as a supervisor for Board 491. So because there is this cross-pollination, so to speak, of the different professions, and this kind of gets into an area of hopefully not contributing to the silo effect between the professions. But I think it's important that if you're going to be cross-supervising, that you know a little bit about the professional orientations and some of the subtle differences in the mental health helping professions. So sometimes I review this slide with supervisees and we talk about maybe some of the differences in training models, and I'll briefly review this. And I definitely compare it also to some of the other helping professions that we work with in the different sites and agencies. So for example, psychiatry, the terminal degree for independent practice is an MD or a medical doctor. The educational background and training is in medicine. And the philosophical basis is going to be in the medical or the disease model, where there is this a disease that is to be treated. The professional association is the APA, or the American Psychiatric Association, not to be confused with what we're about to cover, APA, the American Psychological Association. And I point out to supervisees that this is the APA that, of course, produces the DSM. Of course, psychiatrists are part of the American Psychiatric Association and also AMA, and they are licensed as medical doctors, and they also can get board certified in psychiatry. Next is psychology. The terminal degree for psychology would be either a PhD or a PsyD, the Doctor of Psychology. The educational background has been traditionally in the Boulder and Vail models, whether it's a scientist practitioner or science-informed practitioner. The philosophical basis traditionally has been in the medical and disease model, again, where there is a diagnosis or a symptom to treat, although more recent models do get into aspects of positive psychology and strength-based approaches. The professional association is APA, or the American Psychological Association. And again, APA Code of Ethics. I like to point out to some supervisees that this is the APA that does the publication manual for, of course, APA style. And psychologists become licensed as psychologists. Next is social work. And social work, the terminal degree is going to be a Master's of Social Work, although some programs have an MA, a Master of Arts, or Master of Science. The educational background is in social welfare and advocacy. And the philosophical basis for social work is in negotiating social systems. The professional association is the NASW, the National Association for Social Work. And the codes of ethics include the NASW or the CSWE. And the license for social workers is going to be the LCSW, the Licensed Clinical Social Worker. Next, we have marriage and family therapy, where the terminal degree will be a Master's of Family Therapy or a Master's of Marriage and Family Therapy. There will be a Master of Arts or a Master of Science, possibly, depending on the program. The educational background is systems theory, and the philosophical basis is looking at the individual in the context of their lives, in the context of other relationships, not looking at a person as completely separate from their other systems. The professional association is the AAMFT, and the codes of ethics include AAMFT or COAMFTE. And the license is the LMFT, the Licensed Marriage and Family Therapist. And last on this slide is counseling. Counseling, the terminal degree, will be a master's degree as well. It may be a Master of Arts, Master of Science, or Master of Education, depending on where the program is housed. The educational background comes from a developmental model, for example, where it's believing that people do the best they can with what they have, and also meeting people developmentally where they're supposed to be at. The philosophical basis comes in the form of wellness focus, strength-based focus, and prevention. Our professional association is the ACA, or the American Counseling Association, although school counselors typically belong to ASCA, or the American School Counseling Association. In our codes of ethics is ACA, which is the American Counseling Association, and our accreditation is through CACREP, the Council for Accreditation of Counseling and Related Educational Programs. The license here in Florida is an LMHC, which is a licensed mental health counselor, although the majority of states in the country refer to it as the LPC, which is the licensed professional counselor. And again, school counselors don't get licensed in Florida, they get certification. So I go over this in case you are cross-supervising across some of the different professions, for example, with Board 491. And that way you have a little bit of insight into some of maybe the different conceptualization models with which a supervisee might present in the supervision session. So I think it's also important too that you are aware of the specific requirements among the different professions in order to get licensure if you're providing that pre-licensed supervision. So for example, with Board 491, with mental health counseling, you have to provide 100 hours of face-to-face supervision for every 1,500 client contact hours in no less than 100 weeks. And so this will hopefully help keep you on track as far as scheduling and when to meet to provide that supervision. You must have individual supervision at least every other week, so it can't be just group supervision the whole 2 years. And if it's group supervision, there can be no more than 6 in a group. So at the end of the 100 weeks, or the 2 years, the supervisor must create and send a signed letter to Board 491, actually stating that the supervision has occurred and completed. There's actually a form. Before the supervision can occur, the supervisor must create and send a signed letter to Board 491 with their intent to supervise. And again, with the supervision, the supervisor must be in the same room. There's no cyber supervision. Another national credential you might consider is the ACS, or the Approved Clinical Supervisor. This is a credential that attests to the educational background, knowledge, skills, and competencies of an approved clinical supervisor. And I have the link here on the slide if you're interested in learning more about that. Typically, the requirement would be a master's degree or higher in a mental health field, and you would be licensed as a mental health provider or certified as an NCC. And you would have a graduate clinical course in supervision, and a total of 30 clock hours of workshop training in clinical supervision. Also, you must have endorsement from a qualified supervisor attesting to your supervision experience. I want to end by revisiting the perspective that we used at the beginning of this webinar, and that is revisiting your recollections and your own experiences with supervision when you were a supervisee. And because clinical training is so important, several researchers have looked at aspects of effective supervision. However, these researchers asked the supervisees themselves what accounted for both good and bad supervision. And the following list integrates the list of features to remember to avoid being what's called a lousy supervisor. So, for example, don't reveal any of your own shortcomings to your supervisee. Don't provide a sense of safety so that your supervisee can reveal his or her doubts and fears about competency. Place the importance of service delivery above your supervisee's educational needs. Don't support your supervisee's strengths. Only point out weaknesses. Involve your supervisee in the conflicted dynamics among professional staff in your setting. Also, continuing the list of how to be a lousy supervisor. Allow yourself to feel threatened by your supervisee's competencies. Insist that your supervisee work from the same theoretical orientation as you do. If you sense the presence of conflict in the relationship, don't bring it up. Treat your supervisee as a confidant. Use him or her as a counselor. And finally, be sexist, ageist, multiculturally incompetent, and the like. I'd like to thank you for your attention during today's webinar. I hope you found this information beneficial for your professional development. The following slides contain references for your convenience. Thank you.